me greet you in the name of the Faculty of Dentistry. My name is Kinga Turzó. I am Associate Professor and mainly a biophysicist. Today I will tell you some stories about lasers used for surface modification of dental implants, because this is our main research topic. And first of all, as I am a teacher, I like to introduce what will be the topic of your lecture. I don't know where to sit because it's too hot. Can I come here? And what I would like to tell you that you should feel free if you want to ask questions whenever you want, if you stop me, yes? I will tell you more about applications of the lasers in medicine and medical and biomaterials, you will see. So first of all, I will start with the introduction, with the introduction of the Faculty of Dentistry. Okay. Then we will introduce the research program in this respect, and I will make the connection for you very clear, what is the connection between our research field and the biomedical sciences. Furthermore, I will tell you some main characteristics about the dental implants, because these are the most frequent dental implants in the human body. And then we have to go in the surface aspects of biomaterials and to speak about biorecognition. The second topic will be, we will focus on the surface modifications of, which are enhancing the biointegration or osseointegration of these implants. And we will have two classes to speak about, physical chemical modifications and biochemical. But as the laser systems are usually a physical chemical surface modifications, we will focus now on these. We have some research studies also about the biochemical, but I will not tell you anything about that on this lecture. The laser ablation of titanium surface is a huge topic. I made a short background or literature overview for you. We will go through it as quickly as we can, but I think it's very informative for you. And then we will turn to present, I will turn to present our results. We have made, together with the quantum physics department, quantum electronics physics and quantum electronics department together, we started already a very good collaboration, and we have a nice article in biomaterials, and these are the so-called previous results, which unfortunately we could continue only after let's say almost 10 years, but we finalized them, and I will present you also some biological response experiments, most precisely in vitro cell culture experiments, because this is also our research area. So let's start with the first one, and I am presenting you to this, not that I would like to present myself too much, but maybe it's very informative for you what is happening with a young researcher in the early 20s, 30s, and so on. So I got my diploma in physics in Bucharest, in Romania. I came from Transylvania. I am a Hungarian minority coming from there, and I moved to Szeged in 1991 and applied for assistant professorship. And my supervisor was Professor Péter Maróti. I defended my PhD, whom you know, if I understood well. You have heard his lecture already. Yes, I was working on delayed fluorescence of bacterial reaction centers, and defended my PhD in 2000. It is usually in Hungary, but I think also in other countries that it is very good for a researcher if you go abroad for a shorter or longer period. And then I won an Alfred Kessler grant, and I had the chance to join a group of periodontologists at the University Louis Pasteur, Strasbourg in France. And here I met this topic, the dental implantology. I have to tell you that this was love at first sight, because it was an application of biomedical sciences, and I have found that my skills in biophysics are very good in working with dental implantologists. And then I came back and I applied for a position as a research fellow at the Department of Dentistry and Oral Surgery. At that time, this department was a part of the Faculty of Medicine, and my goal, or my task mainly, it was that the head of the director of the institute told me that we should improve the research at the dental faculty. It was not at that time dental faculty, I was saying that dental faculty, this is a very long process, but it was a lack of basic research at that time at the department. So I was starting to work with young doctors, with young dentists who are very skillful, I have to tell you. They have very good, as you know, dentist has very good hands and so on, and they are very innovative, and I'm very proud, by the way, for that I have now 9 PhD students, and from them, 5 of them succeeded in defending their PhD. Doing dentistry is not so typical to do research also, although I will tell you some aspects which will prove you that this is not true. I was starting also to teach in 2002, teaching what? Dental materials, because it's, of course, it's very close to a physicist or to a biophysicist. Then I am keeping also until now oral biology lectures, dental implantology, and then I started to make a new subject, or develop a new subject, the biomaterials and biocompatibility. Because at that time already we have realized, or the research realized, the scientific world realized, that dental implants are a part of the biomaterials class, and they are very important, and we have to see, we have to learn about more about the biological aspects. When we started these researches, and we started to publish and also to have PhD students, we also get the possibility to establish a graduate school, which is very important in Hungary. Until then, we were integrated in the graduate school of clinical science of the medical faculty, but then we established the research in dental medicine program, which was in some respect ours, and this way we could focus also on the academic career of the young doctors. I am the supervisor of the biointegration of alloplastic materials research topic, and you can see my scientific parameters, but as I told you, I am most proud for my PhD students, who are already now associate professors and so on. To speak a little bit about the Faculty of Dentistry, based on the WHO data, we know that already 1949 started the instruction in dentistry, but it was a part of the Faculty of Medicine, and mainly due to the strong graduate school also and doing research and having new researchers together with us, we have a very nice new department. You can see there with oral biologists, with microbiologists, with other physicists. We don't have yet a chemistry specialist, but maybe we will have sometimes. So this is really an interdisciplinary area where we can work together. And finally, after long work of the directors and also of the deans, we established the Faculty of Dentistry. At that time we had 5 departments. These are typical, if you go on our website you can see prosthodontics, oral surgery, typical for dentistry, but we established a new department which is more the most important in that respect, that we have the task to prepare the students for research work and also to assure the teacher supply, because maybe you know that this is happening also in your home country, that typically it's not too, the salaries are not too high in an academic career in the university, and usually a dental practitioner can go outside to do private practice, and then of course he will have a bigger salary. So to keep them there, it's not easy. We have a laboratory, you will see it immediately, and I have to tell you we are very proud that the number of the dental students is increasing exponentially, let's say. So we have a very strong practical education, and also we can give back. Now, what I wanted to show you here, I just not to forget, that typically we have 3 duties to do, or 3 activities. First of all, of course, the patient care, and we have a lot of patients because unfortunately, for example, Hungary is in the front of oral cancer because of smoking habits and so on. So this is a big problem. Then we have to do also education and also research. So we have a triple pressure, let's say it like that. It's in here for the others, but this is how it's looking now. Now, these are the most important appliances of the of the Faculty of Dentists of the laboratory. So we have, of course, typical cell culture appliances for working with cells, a sterile laboratory. Then we have a research microscope, the Nikon Eclipse 80.1, maybe you know this fluorescent optical microscope also. And we have, together with the physics department, the atomic force microscope, which is very useful for us because we are measuring many times the roughness of these implants. To see an overview, what kind of investigation methods we are able to do at the faculty. So generally we use the surface science methods like atomic force microscopy, scanning electron microscopy. Zsolt, is helping us a lot in that. Okay. So then we are performing X-ray photoelectron spectroscopy. I think that you know what is that. Yes, for the chemical, I will show you some pictures about that because it's essential to determine the chemical composition of the titanium surfaces. And then the X-ray diffraction, which will give you what is the crystalline structure of the implant, which is also very important because if you change the surface, you have to check whether the bulk is changed or not. Yeah? Then going to the biological response, we established long years and many money we have needed in vitro cell culture studies. Now we are able to work with, it is not written here, I'm sorry, but we have also osteoblast, human oral epithelial or fibroblast cells. Maybe you remember something about biology in this respect, no? Or, no, not too much? Okay, I will tell you something about that. And then we have some typical spectrophotometrical assays like MTT and alamar blue, which are used for determination of these cells on the surface of the dental implants. We are able to do also in vivo animal experiments. Together we are making this in cooperation with the medical faculty. This means that we are putting in the calvaria of the mini pig some samples which are changed or not and so on, and we are checking their osseointegration after 1 month, 2 months or 3 months, and this is of course it's an ethical committee who is approving this, and we are keeping the Helsinki agreement, of course. Now if I go further, so my main research topic is the biointegration of alloplastic materials, and in this respect I have one main topic, and you can find, if you check on my name on the PubMed, you will find these articles. I have brought with me also some articles printed out. If somebody is interested, I can give it to you. So the physicochemical and biochemical modification, and this is also a little bit historical because we started with this kind of research of titanium dental implants, including their biointegration or osseointegration. And then we are, dentists are usually very, they like, fluoride, yes, and they were wondering, this was really a topic found out by the clinician. He was asking me that what can happen with the fluoride on titanium, with the effect of the fluoride on titanium, and we got a very nice article and research done with that. I have to tell you that every chemist knows that if you have a low pH, acidic pH, then you will not have any more titanium dioxide, you will have not a native titanium dioxide, you will have a natrium fluoride, titanate layer, which is not good for the biointegration. Then, going further, the effects of chemical agents which are used in dentistry generally. I'm showing you the periimplantitis. It is also very important for using decontaminated titanium implants, and these are, but I will not present you them. I will speak more about the first part. Now, why I like this research, why we like this research topic, and why it is going since 14 years, if I count well, because it is basic research in some respect, but it is highly applicable to biomedical sciences and also to industry. So therefore we have grants, and we have also support from some companies, and we are dealing with typically those implants which have to have load-bearing capability, like for example, maybe you have seen this is a hip prosthesis, and you can see that its surface is also very complicated, and it has a design, so it's not only like a screw or something like that. Then we are focusing with our research mainly on those implants which are made from titanium or their alloys, because I have to tell you, we have new materials, but still titanium and its alloys are the most biocompatible materials. And of course we are focusing on the surface structure of the metal because that is an interface which is very important for us, and we are dealing with that one. Now, why it is increasing, why it is very important to speak about biomedical science. I have to tell you that I think that everybody already who has, for example, I think that each of you have a composite filling in its tooth. Okay, that is already in some respect a biomaterial. Why? Because it's under your gingiva. And which means that it has to be integrated in your body, or if you speak about stents or hip prosthesis or knee prosthesis. And of course, what is happening? We are happy because we live more. Yes, that's true, but our organs, they cannot survive so much. So therefore, you can see this kind of books in 2006 appeared that you can speak about bionic human. So already the healthcare system is dealing with a lot of problems taking care of these people, and of course this is good because we have a longer age, but this means that we have also some strong money here in the background. So I don't want to go too much in these billions and so on, but what you can see that in 2007 already almost $5 billion market was for dental implants and bone grafting, and well, we like it or not, the driving force is always the money. So unfortunately for this kind, so this is the truth. Now let's see what are the most often used biomaterials. We can call them alloplastic materials, it's a synonym. The most frequently are the dental implants, but if you think about a drug, that is also biomaterial, because it's encapsulated in a polymer, which goes, you are swallowing it, and I have to tell you, it's not so easy to make that it will dissolve exactly just where it has to be, so it has to do. Then, if you speak about artificial skin, it is also very important. Then artificial joints, knee and hip prosthesis. I know that maybe I'm sure that you know. So older people who survived only because of these artificial hip and knee joints. And then we can speak about artificial organs or vascular grafts, and stents and so on, which are also made many times of titanium. Okay. To prove you that this field is very important, I'm sure that you have heard about that. You can see how it increased the impact factor of the biomaterial. This is one of the most important journals of this field. In 2003, when we were publishing, it was just around 3 impact factor, and now, last year, it tripled. So it is really very new and strongly developing field of science. What is related to the biomaterial science? It's another field, biological surface science, and it is funny if you think that a physicist named Ben Cassamo, and just in 2002 realized that we cannot speak only about surface science, we have to speak also about biological surface science. And why? Because of course we have medical implants in the human body. You have heard, I'm sure, about biosensors and biochips for diagnosis. You can see it here. Especially it's interesting in the United States, where many old people live alone, okay, and it's very costly to take them to the hospital. And I think that already in Japan is already done that even you can control the blood sugar level with this kind of chips. Okay, so everything is going in this respect. Then if you speak about tissue engineering, bioelectronics, artificial photosynthesis, and biomagnetic materials, all of these are integrated in this biological surface science. You will, in my lecture, you will understand more why we speak so much about surface science and what is dealing with. So it is dealing with studying the processes and properties of the interface of the biomaterial and the biological response, which is not so easy, as you will see. And also we are fabricating biofunctional surfaces. In its name, you can understand those surfaces which are functionally helping the healing, let's say, or the biointegration of these implants. Now, if we go in a little bit more to know, in general, we can say, I'll show you here only some dental implants, but it is true also for hip and knee prosthesis, etc., as I told you. Usually, we have to speak about 6 factors, and from these 4 are related with the material. In biomaterial science, we always divide, and I don't know if it's seen something like that or not, but this is how we teach also dental materials for our dental students, that they have to understand that the bulk and the surface characteristics of a material are very distinguished, they are very different. So we are always teaching them a lot about bulk and a lot about surface and so on. Then the design, it's very important. I have to tell you it's not so important for me because this is more an engineering factor, but I have to tell you that companies are hiring, and the best implant manufacturers are hiring very good engineering specialists who are making the design better of this material. Of course, the applied surgical technique is very important, which means what? That the doctor has to have the skills, yes? This is a must. And the last is the general health condition and life quality of patient, which is not the least. It is the most important. So many times, unfortunately, you can put any very good material in the oral cavity of the patient, but if he or she does not take care of it, he does not clean it better, then it will be kicked out. So it will not be biointegrated. And for you who like IC equation, I promise you that this is the last equation what I show you. Also the dental students, they understand it, it's not a problem. So we can, regarding the biomaterial, we can define the reliability, which I think that you have learned a little statistics. Yes, if a biomaterial is reliable totally, then you give it 100%, which means 1. Yes, we can use here. If and the reliability for biomaterial is very obvious, it will be 1 minus f, which is the probability of failure. Now there is a strong relationship because it is shown that if you have several factors, this will be it will be the multiplication of these factors. So which means that you can make let's say a perfect bulk and surface characteristics, you can make a perfect design or biocompatibility, but if by chance the doctor was not too good in the surgical technique, then one factor will go very close to 0, so therefore the total reliability will be also going to 0. Okay, so this is why we say that it's a teamwork. It's not only the doctors who are important in it, but also the patient is in the team. Okay, I have given you here definition. It's not so important, but maybe you will use it. What I only want to highlight that intimate contact, we have to learn what is that intimate, surrounding tissues, and it does not have any adverse damaging effect on the body as a whole, so not only the neighboring. Now, together with the biointegration, we have a definition for the biocompatibility, and for example, if you check on the internet how many companies are working already with determination of the biocompatibility, you will be astonished. So huge companies are working with that. And what I wanted to show you that this is a little bit similar with the biointegration, but if you read it carefully, you can see that there is a difference between them, because biocompatibility means that the acceptance of this implant by the surrounding tissues. And this was defined in Bronzino, which is, I think, one of the most important books available in this field. Then what you should not forget, and this Lamelis, he was a very good researcher in dentistry, was saying that biocompatibility is a dynamic, always changing phenomenon. And why we are saying this? Because many dentists think that if they implant a dental implant in the oral cavity of a person, then okay, it will stay there always. Now, it is a very good indicator on the health, on the general health condition of the patient, if he comes back after 5 years and he tells you that something is hurting there, or it has blood and so on. It means that something changed in his overall health, and therefore it is related to biocompatibility. So this is an indicator, and it can change, of course, and this is why we say it's a dynamic, always changing phenomenon together with the health. Now, I only wanted to show that we have definition about biocompatibility, but we have more on that. We have standards which are giving us, and maybe you cannot see, but I will explain it to you, that we define 3 classes of biomaterials, One biomaterial, for example, it can be a drug which stays in our body less than 24 hours. Then for sure it will have not so strong biocompatibility tests to fulfill. Then you can have contacting, so-called contacting devices between 24 or 30 days, and then you can have devices which are staying there in the human body then more than 30 days, and of course for these you can see many X's, so it is a very strong standard requirement for that. If you want more to know about it, please check ISO standard 10993. This is all about biocompatibility. It's very interesting, by the way, to find about that, and you can see if you go. Okay. Now, this is also a slide which I teach to the dental students, that they should not forget that dentistry is not only just about filling the tooth or taking out the tooth, yes? Behind their knowledge, it stays a big history, because since many years, let's say since 4,000 years, I did not wrote you here, but already the Chinese, 4,000 years ago, they were using gold wires for putting together the tooth. Okay, so these are the first biomaterial, let's say. But what you can see here, it's around 1,400 years ago, the Mayans used seashell segments for implants. And it is my first question, that what do you think, what is the most important property, or why it is very similar? Why they thought that the Mayans, that okay, it's good a seashell to put in. And I have to tell you, this is the skull of a lady who died at, I think, 26 years old or something like that, but not because of the implants, of course. And it was determined that the dental implants are also integrated, by the way. So she was working with them, she was eating with them. So what do you think, what is the similarity, I'm sorry, I'm tired. Similarity between the seashell and the tooth? Maybe you have some biological. Calcium? Calcium, calcium phosphate, yes? You have calcium, of course, they were, I think, empirical people, how we say, it was white, okay, so strong, I'm sure, but by the way, it is calcium phosphate what you have there, and it was working. Now, what you see here, this is not a trick, really, this is a nice aesthetic smile of a lady or stuff, okay? And behind it, you can see so many dental implants. So what we can say, that we are successful in some respect, that, okay, we can do much better restorations. But I want to tell you that to work with dental implants, it's very important in that respect that we know that the oral cavity is the most aggressive environment in our body. Why? Because you eat there, you drink, you take in food, you have bacteria, you have high temperature changes between 5 and 55 if you have eaten ice cream and so on. I think, do you know maybe how many bacteria do you have in your oral cavity? Family of, how do you call them? I don't know yet. Okay, family of bacteria. Around 500, okay, types of, so not only the number. So a huge bacteria number, and of course this is, if it's in equilibrium already, you know it's everything okay, because if this equilibrium is not good, then it will change something. And we shouldn't forget about the pH. You have heard about cola, of course, and you are drinking, and you know the story, but really they are very aggressive. So it is very aggressive to use these, and even the enamel, which is one of the strongest material in the human body, it can be disrupted by acidic pH. Now we say that we are successful, and I slowly want to go to to explain to you why we need surface modification of dental implants. We have still, what you can see here, this part is the tooth and this part is the dental implant. We have two problems still not resolved, and this is also, I like this slide because we think, the humanity thinks always that we are very ingenious and we are inventing many new things. Of course it's true, but in biomedical sciences we are just mimicking the nature at this time. So unfortunately we cannot do it better than the nature, Mother Nature done, so we are copying what it's doing. But in the respect of dental implants we have two problems. The first problem is that the soft tissue, the gingiva, in a healthy tissue you will have the collagen fibers which are especially perpendicular to the tooth structure, and they have a very strong connection there. This will protect the tooth, the other part of the tooth, the dentine, from the bacteria. Now, in the case of implant, unfortunately, we still do not have that material where these fibers will be perpendicular. These are always parallel. So this is shown already from histological slide. Unfortunately, at this time, we cannot make this kind of implant. Then, we say that you will see about osseointegration, that we have a very good connection between, a direct connection between dental implant and the bone, but we would need the periodontal ligament. What is doing the periodontal ligament? It's physiologically it's very important, and it is like in the car, okay?
Silence.
Okay, thank you very much. So it is. So this is why many times the patients are coming and saying that when I masticate on my dental implant, I feel that this is not good. Yes, because it is lack of the periodontal ligament, and of course from physiological point of view is also very good. It's another story that if you have an inflammation, then you will have a fibrous capsule, and the dental implant will be kicked out. So it's not obvious that always the dental implant is integrated. Okay, so these are the two most important problems, and as you see, what we can do, the bulk is already given. We know that the titanium is one of the best one, or you have the zirconia and so on for alternative, but what is here? The surface, this is the interface. The surface of the material is very important, and this is when they realize that this is the key point. We have to deal with the surface, to change the surface in that respect, that we should improve these problems. Okay, if we go further, this is a little bit more practical point of view, that if you have a dental implant, then I think that already you have seen many dental implants now. You can observe that this is not only a screw. Yes, this has a design. It has every millimeter, every micrometer has its why it is there. So we will not deal with this part, with the prosthetic part. This is, but it is important because this is usually the part of the prosthodontist who is dealing with the mastication forces, because you can imagine if you don't make a good mastication there, then it will make movement of the dental implant and it will come out. But this is a crown, usually a porcelain crown. Then you have the gingival attachment or peri-implant mucosal seal. As I told you, it's very important because you don't want to let the bacteria to go in. And then, of course, you have the osseointegration, which is the so-called anchorage in the host bone. It has a nice history. By the way, I suggest I did not present it here. Professor Böhnemark, who was an orthopedic surgeon, he realized in the late 60s that what is happening there, and he struggled for around 30 years until his idea was accepted, by the way, that osseointegration is really the anchorage in the host bone, but it is true what he had found. You can find him on the PubMed, it's a really nice story. Now, if we go further, so it means that we have different functions of the dental implant, therefore we have different surfaces. And this is true. When you fabricate, you can see a smooth surface, which is not so important because it will be covered by a crown. This is this part. And usually I have to tell you, this is a design tube-in-tube system. So the first part is that you are putting in the root part of the dental implant, then you wait 3 months, because this is how much it takes until it will osseointegrate, and then you take out the healing cap, and then you can, of course, you will give a provisional tooth for the patient to be able to eat with that. Then you have the B part, which is an oblique, usually a meshing surface, which is a problematic, as I told you. Still we cannot achieve perpendicular attachment of the collagen tissues. And then you have a rough surface developed for anchorage in the bone. I have to tell you, this is already very well established, that it has to be sand-acid and acid-edged, and the given it's around 0.5 and 1.5 micrometer in roughness with atomic force vibration measuring. This is how what the osteoblast like, and it will be they will be integrated. Now, especially I show you here types of dental implants, and as you can see we have a huge variety. So it's very hard for the dental practitioner, by the way. You can forget these blade type implants because these are not working mechanical point of view, and usually they are destroying the bone. So I would say that this is forbidden to put in anymore. And you can see that this shiny, it means that it's a polished one. This is already sandblasted acid edged. This is, by the way, an alumina, and this is hydroxyapatite covered. So you can see that already we have, when the dental implant comes out from the factory, then it's already surface modified, okay? And this way you will see. Now, one or two words about dental implant, about the material of the dental implant. So maybe you have learned already that titanium is a very light material, but it's also so strong like the steel. And it has a low density, it has a low heat conductivity. It is, relatively easy to fabricate because it depends what you are comparing. It has a very good radiographic image, which is very important for the dentist, of course. It has an exceptional corrosion resistance and a high degree of biocompatibility. These two aspects are very important. I will go a little bit in details. So, because I think that it is a field which you have to know, or maybe you are feeling comfortable. So what we know that the titanium, so if you have, and of course we are always in oxygen in air, so you can never see pure metal titanium. Yes, because it's possible you have an oxygen layer. Why? Because the titanium dioxide has one of the highest heats of reaction, the delta H. The enthalpy change is minus 912 kilojoule over mole, which means that in 1 second it will be covered by this thickness of titanium dioxide layer, which is very good because it's against corrosion, it will not leave any impurities to go in. Okay, so this is very good. We have another metal, tantalum, it is similar, but it's 4 times much heavier than the titanium, so therefore it's not good to use. You can imagine if you have an old lady who has a hip prosthesis of 1 kilo or 4 kilo, it's not different, so it's very important to take this respect. Then you have the other aspect which was found by Lamelis. He determined that it has a very special dielectric constant, the titanium dioxide is one of the highest. It's between 50 and 170. I think for alumina you have around 3 and 10, which means what for us? That those biomolecules which are coming there in the fluid, they will be able to make secondary bonding, especially van der Waals bonding with the titanium dioxide. And this is a strong. It's not like only an attachment, it's not only like an adhesion, it is a secondary bonding, especially van der Waals bonding. And this is why titanium is capable to be biointegrated in the bone. Okay, let's go further. So I think that you understand now that we have a longer age, more people missing this. Of course, more pensioners, they have to work, of course, they without tools how to eat and how to work, etc. So I'm sure that you know that it is increasing the numbers. So in Hungary, we implant, the doctors implant around 200,000, and in the European community it's around 1 million. But we have a very important up-to-date demand, named that we have to optimize or accelerate osseointegration, because as I told you, the osseointegration takes minimum 3 months. So that is a long period for the patient, even if he gets a provisional. And what you see here, this is a patient who got in 2 stages. So first it was implanted the root part, then after 3 months it came, it was covered, and these are the crowns which are, it's totally similar and it's working very nicely. So we have realized very clear the research in this field, they have realized that it's a must that we should understand how it is, how it happens, this whole biointegration and osseointegration. And they have realized that yes, the interface, the place of the interaction is very important. I have to tell you that in the 1980s, still they did not believe that on the biomaterial bone can form. Every doctor and every biologist believed in that only from the old bone it can form a new bone. But you will see some later that also on the biomaterial, so it is a, let's say, the gap between a biomaterial and the bone hole, it is filled very quickly because you will have blood there and the bones are coming, and it is vice versa, and you have an interaction for sure. And this is the finding of the last 10-15 years. Now going to the surface properties of the materials. It's very simple to understand that, of course, these are carbon atoms, if you can see here. If you have in the bulk, yes, you don't have any free valences, but of course you have to have some free valences here. This is why I'm telling to the ladies that this is why we always have to clean, to take the dirt from the table and so on, because the dust is coming there. So this is typical, it's contaminated. Once I had a very good experience, we were going to Oszkó-Berci, who is measuring XPS for us, and we were taking a dental implant, sterilized and everything, and then he was taking out and at that time the XPS was in the ground floor or something like that, and a lot of plum, was detected on the XPS because it was readily contaminated very quickly in the surface, and of course in the material it was not there. So it is uniquely reactive, different from the bulk, readily contaminate and variable or mobile. This is more the variability. I will not say that this desk will change to be a chair. This is not about that. But the polymers, for example, typically if they are in air or in water, they can be held in another way. And then they started to speak about what is happening, that the material will transduce the biocompatibility aspects, and they have defined the so-called biorecognition, because these studies show that the body, for sure, it is reading the surface structure and it will respond. And we know this already at the cellular level. So different cells will behave in a different manner. What are the parameters of the biological response? Of course, the chemical composition is important because it's not the same if you have titanium or alumina, of course. Then the crystalline structure is also important. I will speak you more about surface roughness. So surface mobility, it's more about polymers. And then we have the surface energy, which is also a very important aspect in dentistry. The so-called wetting capability, hydrophobic and hydrophilic properties of the materials, because it was shown that the hydrophilic material, it will be integrated much better. If we have time and if you have more patience, then I can show you a video regarding that, because it shows you a Straumann implant which was very nicely encapsulated, and they had a very good clinical results. You will tell me whether you want to see that video, but by the way, it's a very good video in this respect. Now let's see the steps of the biorecognition. So, and I have to tell you, this is the outcome, or these are the results of many years of study of biophysicists, biochemists, histologists, clinical studies, and so on. So I'm telling you only the top story, and you can read it in Ben Kassamu's article in Surface Science. So, because I have to tell you that the doctors usually they say, okay, I implant dental implant, and then they understand from that process when the macrophages are coming there eating something, yes? But let's say the events before that, they don't understand. And I like this presentation really because it will show you. So first of all, we should not forget when you are drilling a hole in and I hope nobody is feeling bad if I tell you about blood, or so I will not show you. Okay, so what is happening? If you, the doctor drills a hole in your bone, yes, there you will have blood and saliva. But mainly what is the constituent of this is the water. Okay, so the water shell is primarily very important, and what they have seen and proved that if you have a clean surface, you will have a normal water shell. If you have impurities, if you have a contaminated surface, then you will have a distorted water shell. And already here something problem is happening. Then on the microsecond and millisecond time scale, you know what are the most important molecules in the blood and in the saliva? The proteins, yes? Proteins. And you know also that if you have a good protein, an active protein, it has a tertiary structure and it can work, yes? It can do its function. But if this protein has not a good layer of water shell, then it will be denaturated, so it will fall apart. It means that you will start to have there a contaminated surface. And then if you go further, after these steps, in second time scale, the cells, typical cells, osteoblasts and so on, fibroblasts will come there. And as you can see, if you have a denaturated so-called conditioning film, the cell will not like this surface and the implant will be kicked out. It will be not accepted by the body. But if you have a good protein and water shell layer called again conditioning film, you will have a very nice response, cellular response, and thereon cross integration. So when they have, of course, it's very obvious that when the researchers found these aspects, then they have realized, okay, this is the step where I can work with it. If I make a conditioning film, a better conditioning film, then I can help the nature to get the healing better. Okay, Okay, so these are the so-called biochemical surface modifications, which the idea is coming from nature, as I told you, because we understand now what is happening.